Good morning, everyone. My name is Taylor, and I would like to welcome you and thank you for joining us today in evaluating the American Heartworm Society's recommended 3-injection protocol benefits for the safety and efficacy of dogs with Class 1 and Class 2 heartworm disease, as opposed to the FDA-approved 2-injection protocol. If you would, please introduce yourselves and then we will begin.
Hi, my name is Sharisa.
Hi, my name is Ladair.
Hi, my name is Susie.
Hi, my name is Daphne.
Perfect. Utilizing the article Evaluation of Cardiopulmonary Biomarkers During Classical Adulticidal Treatment versus the American Heartworm Society's Recommended Treatment Protocol in Dogs Infected by Dirofilaria immitis by Keratin E. et al. 2014, which analyzes 14 heartworm-positive canines with high parasite burdens divided into 3 groups. Group A had 5 dogs that were treated with the classic 2-injection protocol using Diroblend, also known as melarsoline dihydrochloride. It was administered intramuscularly at the dose of 2.5 milligram per kilogram per body weight. This was done 24 hours apart, which is approved by the FDA. Group B also had 5 dogs, which were treated using the American Heartworm Society's recommended protocol, which is 3 injections of Diroban based on a single injection of the same dose, followed by 2 additional doses at least 1 month later. In Group C, 4 remaining dogs were treated with the same protocol as Group B, but received diminishing anti-inflammatory doses of prednisone. Please discuss the compared outcome performance for each of the treatment protocols.
The results of the study you mentioned reviewed dogs' cardiorespiratory status using biological markers such as D-dimer, myoglobin, and cardiac troponin. They didn't conclude that the treatment of canine heartworm disease using the American Heartworm Society's recommended adulticide protocol was justified rather than the use of the FDA-approved 2-injection protocol. They found that Group A had the highest markers for risk of pulmonary thromboembolisms. Following next was Group C, concluding that Group B had the best outcome.
So the reason this study was significant is because when dogs become heartworm positive, the biggest risk associated with the treatment of the disease is pulmonary thromboembolism, pulmonary inflammation, congestive heart failure, and renal disease, which were all mentioned in the article. With the use of the FDA-approved protocol of the injections 24 hours apart, the adult heartworms are dying almost immediately, whereas the AHS protocol kills only about half of the worms at that time and the other half a month later, allowing the decaying worms to be absorbed into the body versus causing potentially fatal complications within the body.
To further add to what my colleagues have mentioned today, the study also brought up a vital factor that in prior years, glucocorticosteroids have been recommended to incorporate into protocols as to control clinical signs of thromboembolism and inflammation. However, research is now reflecting that the use of corticosteroids may actually cause an increased risk. This is something that definitely needs additional research and was a contributor to dogs in Group C having higher risk markers than in Group B.
That was fantastic discussion. Thank you all for the brilliant insight. I would now like to adjust your focus and ask you to briefly discuss the clinical experience, occurrence, or severity of post-treatment side effects for dogs receiving either the 3 or Type 2 injection protocol.
Both protocols can have similar effects, with the exception that the American Heartworm Society protocol has a higher success rate with the prevention of thromboembolism occurrence. According to the drug label for Diroban, the prevalent clinical observation or adverse reaction reported during clinical trials include injection site reaction, coughing and gagging, depression and lethargy, and anorexia or inappetence. Less commonly seen were signs such as pyrexia, also known as fever, lung congestion sounds, emesis, diarrhea, dyspnea, hypersalivation, panting, and hemoptysis. The label still cautions that thromboembolisms can occur with the disease itself and other rare symptoms may occur.
So I would also like to mention how with the 2-injection protocol, although it may seem to some clients as more convenient with only 2 injections needed 24 hours apart, the risks associated with the animal's health should be a much larger concern. With the 3-injection protocol, it requires additional appointments, but in those appointments, it would also allow for your veterinarian to be hands-on in the assessment of the progression of your pet's treatment.
Great points coming from both of my colleagues. I believe the overall clinical experience is far more beneficial with the 3-injection protocol as opposed to the 2 injection approved method. Both protocols may come with side effects, but it is proven that the 3 injection method, your pet has less chance of developing fatal complications associated with the large decaying worm burden. Also, the risk of the effects will not be as harsh as the 3 injection protocol, as it is spaced out rather than overwhelming the animal with a second injection just 24 hours later that can result in daunting and potentially fatal complications.
Thank you all for your contribution to today's discussion. I know Miss Susie will be in our next discussion today. I have enjoyed listening to your intelligent thoughts. This concludes our dialogue. I believe we have all learned valuable knowledge today that we can carry with us as we move forward in the progression of treating canine heartworm disease.
Thank you, guys.
Thank you.
Good afternoon, everyone. Thank you for joining us for this important discussion on the slow kill approach to treating canine heartworm infections. As we delve into this topic, let's first introduce ourselves again for the audience.
Hello, I'm Dr. Smith from Maplewood Veterinary Clinic. We've been considering incorporating the slow kill approach into our practice, but we wanted to make sure that we have a thorough understanding of its pros and cons.
Hello, I'm Dr. Patel from Oak Ridge Animal Hospital. We've been using the slow kill approach for some cases, but we're also aware of the concerns surrounding its efficiency and the emergence of drug-resistant strains.
And hi, I'm Dr. Johnson from Riverside Veterinary Care. We've been cautious about adopting the slow kill method due to the potential risks associated with it.
Wow, thank you all for your introductions. Now let's continue and discuss whether we could adopt the slow kill approach for all clients and our practices.
I believe the slow kill approach could be beneficial for certain clients, particularly those who may not be able to afford the upfront cost of adulticidal treatment with melarsoline dihydrochloride. It could serve as a more economical option for these pet owners.
I agree. However, we need to be selective in its applications. For example, we might consider the slow kill approach for cases where the infection is not severe and the risk of complications is low. We also need to take into account the pet's overall health and any underlying conditions that could affect treatment outcomes.
Absolutely. We shouldn't adopt a one-size-fits-all approach. Instead, we should tailor our treatment protocols to each individual case, weighing the potential benefits and risks of the slow kill method.
And that leads us to our next point. What characteristics would be important for decision making and choosing among candidates for the slow kill approach?
In my opinion, the key factor to consider would include the stage of infection, the presence of any concurrent health issues, the pet's age and overall condition, and the owner's ability to comply with the treatment regimen.
I agree. We also need to assess the pet's lifestyle and exposure to mosquitoes, as well as the prevalence of heartworm in our local area. Pets at higher risk of reinfection may not be suitable candidates for the slow kill approach.
Additionally, we should consider the potential for resistance to macrocyclic drugs, as highlighted in the research by Sevedis et al. 2017. This could influence our decision-making process and prompt us to explore alternative treatment options for certain cases.
Finally, how would we verify treatment efficacy with the slow kill approach?
So regular monitoring is crucial. We would need to perform frequent heartworm antigen tests to track the reduction in the worm burden over time. It's also essential to keep pet owners informed about the progress of the treatment and to emphasize the importance of compliance with preventative measures.
I agree. Follow-up examinations and diagnostic testings are essential for assessing treatment response and detecting any complications or resistance issues early on. Open communication with clients is key to ensuring their understanding and cooperation throughout the treatment process.
Additionally, we should stay informed about the latest research findings and recommendations regarding heartworm treatment and prevention. Collaboration with specialists and participation in continuing education programs can help us stay with the developments of the area.
Thank you all for your valuable insights and contributions to the discussion. It's clear that while the slow kill approach may have its place in certain cases, careful consideration and individualized decision making are essential to ensure the best possible outcomes for our patients. So let's continue to stay informed and proactive in our approach. to heartworm management and practices.
Thank you.
Thank you.
Oh my gosh, Max, are you okay?
Good afternoon, Taylor. How can we assist you today?
Hi, Sharisa. We are new to the area and looking to get established. This is my dog Max, and he's overdue for his checkup.
We're so glad to have you and Max. Let me get Dr. Susie for you. She'll be able to answer any questions you may have and guide you through the next steps. So
Thank you.
Susie's ready for you. Just follow me into the exam room.
Thank you.
Hey Taylor, is this Max?
This is Max.
Hey Max.
He's a pretty good boy.
Okay.
He's not feeling his best today.
Oh, he's not? What is he doing?
So he's got kind of a cough. He's kind of lethargic. It's been a while since we've had him at a clinic. So I definitely need to get him checked up.
Well, I'm just going to take some samples from him today. Since you said it's been a while, we are going to go ahead and run a fecal and collect some blood for our heartworm test. And then Dr. Susie will run them, which will take about 15 minutes.
Okay.
And then Dr. Susie can come back in here and discuss any results with you.
It's okay, Max.
Alright. And so we got a fecal. Alright. Oh, thank you for twisting that off for me. Okay, good job. Alright.
Are you okay, Max?
Alright, I will be back. He's free to be down. And Dr. Susie will discuss these with you.
Hello.
Hello.
Good afternoon, Taylor. I'm Dr. Susie, and this is Daphne,
Hello.
one of our student interns. I hope that's okay.
Oh, that's fine.
How are you and Max doing today?
We're doing okay. Max is not feeling his best though. He's got kind of a cough. He's kind of lethargic. He's just not really feeling his best.
Not really feeling himself, huh?
Mm-mm.
Well, he's a very good boy. Unfortunately, I did look at the heartworm test results, and he was positive for canine heartworms.
Oh.
Not to alarm you, as it's something that we can treat, but it still might be a little upsetting.
Oh wow, I never expected to hear that. I'm not really familiar with what canine heartworm disease is. Max takes a monthly dewormer for intestinal parasites. Is that something similar?
Well, first let's talk about how Max may have become infected. So basically, heartworm disease is transmitted through the bite of an infected mosquito, and even if Max stays indoors most of the time, he can still be at risk. Heartworms live in the heart, not to be confused with the gastrointestinal parasites, which are a little different because they're not prevented or treated, and those are using GI dewormers instead without the inclusion of a heartworm preventative.
That makes sense. We'll definitely be more vigilant about mosquito and heartworm prevention then.
Absolutely. So now it's really crucial to understand the risks of not treating heartworm disease. If left untreated, it can lead to serious health problems. So we don't let it get to that point. But including thromboembolisms, heart failure, and potentially even organ damage, which could be life-threatening for Max. We don't want that.
Oh no,
Mm-mm.
we definitely don't want that. What would we need to use to treat Max?
So we'll run some pre-treatment tests, including blood work and radiographs, and I know we took some blood work earlier, so we're running that. Radiographs and possibly an echocardiogram as well. And it'll basically assess the severity of the infection and ensure that Max is healthy enough for treatment. And then we have a few different options for treatment, but for Max's case, I recommend the 3-injection adulticidal treatment with melarsenine dihydrochloride, which is also recommended by the American Heartworm Society.
Okay, that sounds like a great plan. What happens during and after treatment?
So during treatment, Max will need to rest and avoid strenuous activity to allow his body to heal, as it's vital for him to make sure to leash walk him and crate him during this time, during this treatment, as it's vital for his continued well-being, and as the adult heartworms begin to perish, essentially. So we'll schedule his follow-up and for each injection, and we'll monitor his progress and checking for any complications. It's also vital to begin a heartworm preventative to prevent reinfection because we don't want this to happen again. So I'll prescribe a product called Simparica Trio that you'll administer once a month.
Got it. Thank you so much, Dr. Susie and Daphne, for explaining everything to us.
You're welcome, Taylor. We're here to support you and Max every step of the way.
Hey, Dr. Susie. I just checked, and we actually have one more box. It's a perfect size for Max.
Oh, perfect.
Good.
Just for his weight too.
Oh, wow.
So it just comes in a box like this, and we'll have instructions on it for you, and we'll just do that every month.
Wow, so that
And he'll
does
be
fleas,
protected.
ticks, heartworms, and roundworms?
Mhm.
Awesome. All right, Max, let's get you home and
Such a
feel
good
better.
boy, Max. Yeah.